Hi guys, I'm Dr. Salcedo, your conscious gynecologist, and I'm a board certified OBGYN and clinical researcher. Over the course of my clinical work, I've become increasingly aware that conventional approaches to women's health and gynecology were largely focused on medications, hormones, and surgical therapy. This, for me, did not fully address the underlying drivers of many conditions like endometriosis and uterine fibroids, and my patients were naturally frustrated and dissatisfied with routine gynecologic care. This realization led me to investigate the root causes of gynecologic disease, particularly the roles of metabolism, endocrine function, immune function, and inflammation. From this work, I developed and introduced the term metabolic gynecology to describe a framework that more fully integrates these dimensions of women's health. The focus of my work is to position metabolic gynecology as a scientific discipline that examines how immunologic, endocrine, and inflammatory processes shape the structure and function of the female reproductive system. This framework recognizes that environmental and behavioral exposures, in conjunction with endogenous factors, activate epigenetic pathways that contribute to disease expression. Contemporary lifestyle and environmental influences, including insulin resistance, chronic inflammation, sleep disruption, sedentary lifestyle, micronutrient deficiencies, toxic exposures, psychological stress, and adverse childhood experiences collectively disrupt metabolic and immune balance. These influences may unmask or heighten genetic susceptibilities, contributing to the development of common and often debilitating gynecologic conditions such as abnormal uterine bleeding, infertility, uterine fibroids and polyps, uterine cancer, endometriosis and adenomyosis, and menopause-related disorders. Through both research and clinical practice, my aim is to advance metabolic gynecology as a framework for understanding and treating these disorders in a comprehensive and root cause-oriented way. To deliver this message, I have a patient-friendly YouTube channel called Conscious Gynecologist. I authored several scientific publications supporting this research, and I am a part of the scientific advisory panel for the newly minted Coalition for Metabolic Health. I can't wait for the work to come, and I can't wait to include you in this journey.